We are a society that likes to work up a sweat, and in our constant pursuit of wellness, our bodies can sometimes break down. One of the most common areas where injuries flare is the knees, specifically the anterior cruciate ligament. Despite increased awareness and prevention and strategies, these injuries still occur, requiring surgical reconstruction. According to the American Orthopedic Society for Sports Medicine, about 150,000 ACL injuries occur in the United States each year, making up more than $500 million in U.S. healthcare costs per year.
I think that the prevalence of ACL injury has paralleled American participation in sports over the past 30 years. Many more individuals play sports that you run, cut, decelerate, jump, and these are all of the particular activities that stress the anterior cruciate.
ACL injury is more common in women than men for a number of reasons. One reason is anatomy. A woman's pelvis is wider than a male. They're more likely to have a knock-knee alignment of their knees, which puts the knee at risk when they jump and land. The second are the mechanics of the way they jump and land and pivot. Girls tend to land with a more flat-footed gait and a more straight knee, which puts the ligament at risk. There may also be hormonal factors that come into play when a girl goes through puberty, and that's a time of increased risk for ACL injury. And the last may be a component of heredity. There are families that we see where multiple members of a family have sustained an ACL injury, so there may be a biologic reason for that we don't yet understand.
Osteoarthritis is a breakdown of the joint surface covering, the articular cartilage. So we see osteoarthritis very much sooner and in younger individuals when they don't have ACLs in their knee. When I started in this business over 35 years ago, the thought was get the athlete back out on the field, get him back out to play, provide stability to the knee. Much more, I think today, the purpose of treating ACLs is to try to prevent the development of this early osteoarthritis. If we also can get them back to sports participation, that's doubly good. But you want the long-term health of the knee as your primary focus.
A leader in all research and surgery, Dr. Wickiewicz is an anterior cruciate ligament repair specialist. With more than 3 decades in practice, he remains on the forefront of orthopedic surgery and sports medicine, pioneering innovative, minimally invasive surgical techniques for knee and soft tissue injuries and conditions that can help a patient recover more quickly and resume normal activity faster.
When you come in to do the surgery, you'd have already had your knee quiet down, you'd have been through a program of rehabilitation so that you are in the best shape you can to go forward with surgery. Today's techniques, the surgeries are performed with arthroscopic control, and what that means is we don't cut open the joint. We look inside the joint with a tool called an arthroscope, and that allows us to work with the minimally invasive techniques. But you still need to harvest a graft. You still need to use tissue to reconstruct that anterior cruciate. And as a patient, you'll need to have a conversation with your own physician as to which is the most appropriate graft to use in your individual knee. The surgery generally takes about 1 hour. Depending on your institution, these can be performed with regional anesthetic. You don't have to undergo general anesthesia to perform it. The first 3 to 5 days after surgery is a critical time for inactivity. Off your feet, resting, icing, allowing the trauma of surgery to quiet down. Most physicians will have you start organized physical therapy in that 5 to 7 day mark after surgery. And depending on other things that may or may not have been injured in your knee, you typically begin weight bearing, that is coming off crutches, in that second week following the operation.
Since 1982, Dr. Wickiewicz has been in practice at Hospital for Special Surgery here in New York City, America's leading specialty hospital devoted to orthopedics and rheumatology. In addition to treating thousands of ACL patients over the years, HSS also conducts extensive patient surveys and research in critical areas such as arthritis prevention and how knees react after they've had the ACL reconstructed.
One of the hardest things as a physician in an office is to know when that patient in front of you is ready to perform sports. And so at this institution, our physical therapists have embarked on a program to try and develop what are the most practical tests that they can perform in the setting of a rehab unit to see that that individual is ready for performance in sports.
The research being performed at Hospital for Special Surgery runs the gamut from basic cell biology, looking at the function of ligament cells, to clinical outcomes work, looking at response to reconstruction and injury, and to prevention. We have an outcomes database that's tracking every patient who has an ACL reconstruction done at HSS. The third is the Sports Performance Laboratory that looks at ACL prevention strategies, the results of those strategies in both preventing a new injury and preventing a re-injury to a knee that's been reconstructed.
I've been a patient of Dr. Wickiewicz since I was 7 years old when I first tore my ACL skiing. Since then, I've torn my ACL and my meniscus in my right knee playing basketball and lacrosse. So overall, he's done 3 surgeries on my knees. Right now, I have full mobility back in both my knees. I feel great. I'm playing college lacrosse. We're winning. My knees are sort of bionic now. So yeah, feeling good.
The question becomes, how best do you know that your changes are achieving what you want as far as outcome within the patients? So over the past few years, we have begun a registry. And a registry is a tabulation of all patients that have undergone surgery for the ACL. They are interviewed, they fill out subjective questionnaires, they have objective tests performed. And what we do at surgery is recorded. And hopefully we will be able to go forward looking at this in a prospective manner to know which of our techniques, which of our surgical alterations best produce the outcomes that we want to achieve.
I gave up 6 months, but it's worth it now because I can play in college and I'm not worrying about it, I'm not playing through the pain. It's definitely better, and for the future as well. It's not going to hinder anything that I want to do.
There are many different techniques that are utilized to fix the anterior cruciate. I think what you need to do is, when you see your healthcare practitioner, have a frank conversation with him or her that that individual has experience performing this operation, that they understand the surgical techniques, and that they are going to do state-of-the-art surgery on your knee and to give you your best shot at trying to have a healthy knee and prevent arthritis in future.
When you need treatment for a knee or shoulder injury, experience matters. Learn more about Dr. Thomas Wickiewicz and Hospital for Special Surgery, changing lives. For more information, go to hss.edu.